Thank you for joining us today. The topic of the month is the danger behind the vaping trend. And for that, we have Professor Dr. Anna Mary Nathan from UM. Let's welcome Professor to take on the floor.
Okay, so thank you so much to the EWRF Foundation for inviting me to talk on this topic, which is very close to my heart because we're seeing a problem, a rise in a problem with vaping among adolescents. So today I'll be talking about the dangers behind the vaping trend in adolescents. So mainly I'll be talking about the problem among adolescents. So many of you all probably already know what is an e-cigarette or vaping. In fact, initially for a very long time, I actually thought that the e-cigarette and a vaping device is actually different, but they're actually very similar. So you can see here on your left is what we have, the old vaping devices, which were meant to look like a cigarette. And these have progressed over the years to what they call fourth generation vaping products. As you can see, what they call these very fancy pods. So what are these devices actually? So they basically contain a heating device. There is a form of a container which keeps all the fluids or the liquids that need to be heated up and need to create the vape. Okay, and there's always a battery with these devices. Okay, and these are usually what we call handheld devices. So before I really go into talking about what is the problem and what is the issue with vaping, hold on. I would like you all to maybe, if you all could scan this QR code. I'm not sure if you can scan this. Okay. So if you can scan this QR code, and perhaps some of you all then can try to answer this if you have scanned. And basically the question I'm asking is, have you vaped before? So there are not many people who have answered. Shall I go back and maybe let you all scan again? So maybe you all can try to scan again. Okay. Okay, and let's see again. So let me move forward. Okay, so it seems that many of you all have not really vaped. How about the next one? Do you all actually have friends that vape? And actually, yes, one have. Okay. So what's the buzz about vaping? So as perhaps many of you all may already know, as I'm assuming that most of you all are young, is that the cigarette is now actually considered for the old person. That you can see this lady over here. But vaping is actually for the young. Okay, so this has really changed the trend in terms of what is happening here in not only in Malaysia, but everywhere around the world. So here's I would like to share some interesting data. This is actually taken from the Malaysian morbidity data. And here in 2022, what they did was they interviewed adolescents. So here from 2017 to 2022, there is a sharp increase in the number of children. This is 15%. And this is really shocking because what you're having is basically around 1 in 6 children to 1 in 7 children who are actually vaping. Okay, and this when they interviewed these children. And of course, as expected, smokers reduced. So, and this, as I mentioned again, this is an international trend whereby people or children or adolescents who will be tend to spend more time now, or they prefer to vape rather than smoke. Now, what is even more worrying is, and I'm not really wanting we sound very sexist or whatever, but what you see is that when you look at cigarette smokers, hardly any female Malaysians smoke. So even in general, when you look at adults, females actually don't really smoke, which is very good. But when you look at adolescents, you are seeing that there is 5 times more females that actually use vaping. Okay, so vaping is now appears to be more attractive to the female population. Also, what we find is that 3 out of 4 vape users actually started using when they were very young, before 14 years old, and that their exposure for those who vape, half of them have either parents or guardians who vape. And where did they get their vaping from, or where did they get their devices and their refills from? 1/3 is from friends, again, something that is very worrying, and another 1/3 is actually from the vape shop. So let me talk today about what the myths about vaping, because the real reason why these adolescents like to vape is because they think that it's nothing very serious. So many think that it's only water vapor. So it's only water. So let's look at it closely. Yes, there's a little bit of water inside that product. Here you can see in the bottle, okay, it pictorially shows that majority of what contains inside this liquid are all these chemicals. Okay, and you don't see a very large component of water. You have propylene glycol, you have glycerine, you have a little bit of, and you have nicotine, and then you have the flavorings. Now, the vape that you see is actually not from water, but the combination of both glycerine and propylene glycol. So this propylene glycol is actually a chemical. So again, the vape that you see when one is smoking is not from water, but a combination of these chemicals. And one is actually inhaling all these chemicals, which is obviously not very good when basically we are not meant to be inhaling chemicals into our lung. When you break down what are the chemicals that you are breathing in, you have, don't forget, you have nicotine. Where do we get nicotine? Nicotine is actually from cigarettes. You have these volatile organic compounds, like I mentioned. We mentioned the glycerine and the propylene glycol. We also have some ultrafine particles, and some believe that these are cancer chemicals, and the flavorings, which is the major issue, which is a very attractive thing in terms when you look at vaping. So all these chemicals are very attractive because they have nice smells, etc. But these are actually not meant to be inhaled into the lung. And you can probably liken this to when one uses glue sniffing. The principle is basically the same. You're not supposed to be inhaling all these volatile chemicals into the lung. The other thing is that majority of people think it is safe. So this is called the toyol. I call this the toyol, or we call this the toyol from the Ministry of Kesihatan Malaysia. So this is what they put out for all the adolescents and everybody to see. Where you can see the kesan of the vape. It can irritate the eye. It can affect the cells in the brain, and I'll be talking a little bit about it later on, causing seizures and problems with breathing. It can also affect the heart. It irritates the throat because some people, if the heat is too much, it actually can cause irritation right to the back of the throat. It affects the stomach, and definitely it can affect the lung. So adolescents are at this age group. And what we know as pediatricians is that at every part of development, at every part of your life, the body is actually growing at a different pace. And in terms of adolescence, which we define as between 10 to 19 years old, one of the important things to remember is that it is the brain of the adolescent, or the adolescent brain. Y'all are a special group. The adolescent brain is actually very sensitive to stimuli. And people have actually shown scientifically that the adolescent brain is more likely to get hooked on top on whether it's smoking, whether it's vaping. So they tend to get more hooked on it, as well as that there are very severe side effects. So if you can look closely, the adolescent brain is already facing many challenges as they grow up, and we all recognize this. They have to decide what is their path in life. They are constantly being challenged by drugs and alcohol. And mood disturbances are also a big thing for an adolescent, and they are really at an increased risk for mood disturbances, whether you want to blame it on the hormones, or whether you want to blame it on the brain development. And what many people think is that e-cigarettes may actually help, or smoking may actually help these adolescents to get over their problems. But what is even more interesting, as you can see, that there is a relationship between e-cigarettes causing depression, and depression causing them to smoke. So often they will say, I had to use the e-cigarette because I wanted to relieve my stress, etc. But what you find is a bi-directional, we call it a bi-directional relationship, where one can feed the other, and it becomes a very vicious cycle. So e-cigarettes have actually been associated with depression, anxiety, impulsive behavior, and they have even shown that the impulsive behavior includes drinking and drugs. So it seems to be feeding this type of not very favorable behavior, and as well as suicide. So really, e-cigarettes have not been shown to relieve stress, and hence it should not be taken as a way to relieve stress. If you want to relieve stress, my prescription is just do exercise or get involved in sports, and this is a wonderful way for adolescents to channel all their energy into something that is more productive. And do you know that vaping actually causes many other problems? So, for example, in the adolescent skin that is already prone to breakouts and pimples, it increases your skin inflammation and redness. It causes dehydration. It causes wrinkles, acne, and it does cause yellow teeth. So some people will say that, oh, it doesn't cause as much yellow teeth as in smoking, but it still causes teeth problems. It still causes discoloration and smell in the mouth. Among girls, perhaps, more likely in girls, is they actually think that the e-cigarettes actually help you to lose weight. But really, there is no evidence again to show that e-cigarettes actually lose weight. But there is ample evidence. So here are two pictures that were taken off the internet. So in 2017, in the UK and in America, there was a huge epidemic of these adolescents who were smoking and getting allergic reactions and problems with their lung. And this was a huge threat and caused much fear among pediatricians and lung doctors. Because here we expect old people to be sick, but when these young children come in, or these young adolescents come in with disease that can actually take away their life, it is actually very scary to us. So let me tell you a little story. So this is actually a true story of one of my patients. He is a 13-year-old boy, and a very wonderful boy. He is wonderful to talk to, so polite. But he had actually been vaping secretly for the past 1 year. This was in the boys' toilet with his friends. And he could vividly tell me all the many flavors that he was using. So for him, it was like, maybe trying candy or drinking soft drinks, because for him, it meant that it was just benign. After all, he's just smoking all these wonderful flavors. But then one day, he started to become more breathless. And this worsened. He had to have a cough and he was admitted for a lung infection. He also noticed that while this had progressed slowly, he couldn't play his favorite football. Okay, so he was losing out to his friends and he couldn't actually do what he wanted to do. He was getting tired. So he actually went to see a very clever doctor, and I put this clever because this doctor is actually not me, and this was one of my one of the very senior respiratory or lung doctors who picked this up and basically asked the right questions. And when he asked the right questions, he was able to get the story that this boy was actually vaping for the past 1 year. So what is his diagnosis? And his diagnosis is EVALI. So maybe some of y'all will say, why am I telling you about Ivali? But I think that there are some things that perhaps, y'all should know, because y'all are growing, y'all learn biology, y'all learn quite a lot of stuff in school. And perhaps this is one of those medical things that you should know about. Okay, so what is Ivali? Ivali is called e-cigarette or vaping associated lung injury. Like I said, in the UK and America, if you say Ivali out in the street, in the coffee shop, actually everybody knows about it, because it, like I mentioned, it was an epidemic over there. And here you can see, this is a CT scan. You can see a very nice CT scan normal. And here on the right, you can see what happens to the lung after this adolescent smoke. And this was an allergic reaction. Children being very sick, and you could end up. So in this boy, he ended up just like this little boy, whereby you would require some oxygen and play your games. So some again will say, okay, but this vaping is actually bad, but it's better than cigarettes, right? So, so why are we making such a big fuss? Really, the issue is that isn't not smoking just better than e-cigarettes? And it's just like telling your parents, I'm only just robbing the small shop down the road. By robbing, you're something that is going to cause misery to your life. It doesn't matter you. It's just wrong. So again, other myths is that it can help to quit cigarette smoking. And this is a myth that mainly is believed by adults. But studies have shown, no, not really. There is an increase of adults, particularly use both vaping and which a problem, because they are basically having different pathways, and hence you're doubling the chance of trauma to your lung in just so many different ways. So it's really not cool. And what many may not know also is that, so here you see this, what we call the fourth generation pods here. Yeah. So these pods, these stylish pods, can you believe it? They actually contain what we call these nicotine salts. And these nicotine salts are so much more even potent than your normal. And it has been shown again, these type of vaping pods or with joules, you are more likely to get a. Again, here you have a whole scenario whereby instead of using less nicotine, you end up using more potent nicotine. For the adolescent brain, more likely to get addicted to that. So what more if you use more concentrated nicotine salt? Finally, this term is that you cannot get addicted. And why did this come up? It's because never know that this vaping pods actually contain nicotine. So 3 out of 4 adolescents know that it has nicotine. And most of these devices, or I want to say all of these pods will have nicotine. Okay, so one may not recognize, nobody's going to come with a prescription and ingredients in what you. So remember, once you're inhaling nicotine, you are going to become addicted to it. There is no way you are going to say one will actually get addicted because there is nicotine in these devices. So if vaping is so bad, why are there so many people that are using a little? Because the whole problem with vaping is really, if I feel, is a political responsibility. Okay, there was a lot of advertising about cigarettes. So you see here, they actually put a doctor's picture on the cigarette pack, and they dare say that the doctor says it's better to use this. So Marlboro Man. Now the Marlboro Man was actually a very famous. He looks so cool. Here I to backtrack a little bit. So the FDA or regulatory so basically said in 2012 that you are not allowed to advertise these attractive figures. Actually, in the silk cut was the last one in 2002. And if you look at now at all the cigarette packs, here is all these are premature little baby that looks very sick. If you go elsewhere, you will see men with cancer. You will see oral cancers and all sorts of things. Okay, but what is happening with vaping? So this is how all the vaping advertisements look. Now, if I didn't know what vaping was and I saw, whoa, what is this? Strawberry banana, blueberry watermelon, blueberry mint, I'll say, definitely I would want to try it. So here we are allowing an addictive chemical, an addictive, basically smoking agent, and allowing them to advertise so beautifully, and they are attracting you. And we are allowing, again, look at this here, you see this cool man, okay, that is vaping, this very pretty woman that's vaping. And again, if you just put vape and if you look at the internet, all the pictures are attractive, and some of them even dare say things like you will not get addicted. They dare say things like why quit and all of that. It's really a crying shame that we haven't done this. I mean, e-cigarettes have been around since 2003. And now we are 2024. And really, it is for me a crying shame and a crime that we have allowed this to go for such a long time. Yeah. So please be aware that the sellers are basically tricking you, that they are brainwashing you with all of these pictures. And as far as I'm concerned, this is as good as fake news. Okay, because there's nothing cool about the smoking and this vaping, because it is actually only going to destroy your brain and destroy your lung and destroy your life. And even worse, these e-sellers are actually selling online. They are able to get online and they are actually selling online. And the problem is, we as adults and we as parents actually don't even spend so much time on social media. And we're not so clever sometimes to modulate these problems. And our children spend most of the time on social media and they are being exposed. And so this is if you call this it's not right to allow them to be able to post these type of e-cigarettes where children and adolescents are most susceptible. And again, you see here, they sell these little bands or these little bands where you can pull around your neck, and you sometimes you even see people entering into meetings looking like this, as if it's a cool pen. And people say, hey, but if you were carrying a cigarette, you won't be allowed into the meeting. How are we allowing these people to enter into meetings with these type of devices? So again, the advertising is amazing, and the advertising is probably one of the big things that is just luring young people, old people, anyone will lure anybody to use these devices. So there are many things that we can do about, and as an educator, I always believe education is very important. And education doesn't start at 13 or 14 or even 10 years old. Education starts from young. Education starts when they are 4 years old or 5 years old, when they will actually listen to their parents. Yeah, and because when you're already 10 or 12, they're not listening to their parents. The government needs to try to raise the age, maybe more than 21, like in Indonesia, not more than 18. Increase the non-smoking zones. We need to have tighter school regulations so that the young are not being bullied into using these devices, or not being bullied to use this vaping. We need more psychological support for children in school who are facing problems, maybe with depression, maybe with anxiety, so that they won't be turning to these devices, won't have to turn to their not so good friends, perhaps, that will suggest to them, hey, why don't you vape? I heard it makes better, it may relieve your stress. And of course, banning all these illegal sales. And I'm a big advocate that I think we have to really start banning this advertising, because this advertising is just too attractive for everybody. So we know that from 1st October, 1st October, which was, by the way, the Great Tobacco Day. But since the 1st of October, we know that the government has actually now put on things that now it is illegal for minors, sellers, all, if they sell these type of devices, or children are seen in less than 18 years old are seen to be using or selling these products to children that are under 18 years old. So we know that there are rules and regulations now, and they were made basically to safeguard these children, because people have noted a huge increase in use of these devices among the young. And I think, again, the biggest problem is going to be enforcement in Malaysia. So we hope that enforcement will not be a big problem. But I also hope that in the schools, that the teachers will also be more enthusiastic and start talking to the young from primary school onwards, from 7 years onwards. We need to start talking to the young, to educate them, to tell them, do not be lured by all of these people and all of these devices. So my take-home message for today is, remember that this is a poisonous chemical, that it can damage your body. You will get addicted. There is no way you're not going to get addicted. You will get addicted, and it will actually destroy your life, because the risk of it damaging your body is extremely high. And let's not let all these companies destroy your life. Let's be smart and do the right thing. Let's be strong and do the right thing, and not be lured by these companies and your friends who are basically making money out of you. So I end now, and if there are any questions that you all would like, you can again scan this QR code, or you can put it in the chat box. And I can try to answer them if there are any questions. Thank you so much for listening to me on a Thursday evening, where I'm sure everybody is tired and you don't want to take a break or watch some television.
Hi, Prof. I have one question. I thought there's a law against advertisers providing wrong information in the advertisement. Like, for instance, so how come these people can boldly advertise that it is not addictive and it is not harmful?
So I think so for example, when I was actually Googling this vaping, they will mention things like, so it's very subtle. they will mention like, don't quit, it's not as bad. And you may quote, although they have no evidence or they have actually no proof, people still think that the cigarettes is actually worse than vaping. And if you go and do by the chemical basis, they are correct lah, right? So if you look at the amount of nicotine that is in a cigarette versus the nicotine in a vaping device, yeah, is less. But that does not mean that it's less harmful, because it's all about how much you are actually going to, how much are you going to inhale. And the problem is also that besides the nicotine in the vaping device, you also have other chemicals. So, but this problem with fake news, or this false advertisements is something that is actually very hard to control, especially many other issues and problems. So one must be very clever to open the internet and to read the right site before you really understand what is actually going on, or who you're going to listen to. Because you ask 5 different sites, and 5 different sites may actually tell you something that is different.
Thank you. Thank you. Are there any studies that give us the number of primary children involved in vaping?
I cannot remember offhand, but the majority, like I said, the Malaysian morbidity data that was published in 2022 did actually publish on these statistics. But the majority of vapers is still in secondary school. But like I told you, amongst the vapers, like I told you, 3 out of 4 vapers started less than 14 years old. So we know that that's the age, because age of adolescence, you're looking at between 10 to 12. So that would be near primary school, where they may have started or they may have tried. But I'm not sure exactly of the real number.
Yeah.
I cannot remember the exact number. Yeah.
Okay, thank you.
Yeah, cannot remember exact number. Okay, so shall I end for today?
Yeah, just let's open the floor, the question to the floor. If anybody
Okay.
else have questions, then we shall spend 5 more minutes. Let's just wait.
So, do any one of y'all have friends who vape?
Yes, I've seen many of them vape. I would like to ask one question. Has
Yeah.
anyone died of vaping?
In the UK, yes. So when you go to the UK, what you will realize is that when you talk about vaping and smoking, it's not that it's lesser than here, but you see more women and men. But in the UK, there were children who had died. I think it came to the number of maybe around, I can't remember whether it's somewhere about 100 or 62 or so. So and that was, like I said, there was an epidemic in 2017. So it was
Okay.
something about the chemicals that they had been using. And as a case that I recently discussed as well, he may not have died. I mean, obviously he's actually doing well now, because it was like I told you, it was a clever doctor. It wasn't me, it was somebody else who picked it up. Okay, so I think that was really good, and we managed to treat him on time. Now, there's one thing about dying, but don't forget that living on with a significant comorbidity can be even more problematic. And these are young people who think that they can do everything and anything. And they will have to continue their life for the next 50 years, 60 years, with this type of problem, so prohibitive, affect their job, children, life, and it's not cool. So I have somebody who asked me how to help children who are addicted to vaping. Okay, so what we do have in the KK clinics we do have stop smoking clinics. So first of all, you have to identify the child that is vaping. Okay, and second of all, there has to be some recognition from the child, the adolescent, that this is a problem, and hopefully the child has not actually already got into a problem. But you can use this KK's stop smoking clinics, that even stop smoking clinics in what they call it, even in my hospital or in certain government hospitals. So all you have to do is just Google the stop smoking, because these are all it's the same thing. They're all addicted to the nicotine. So they will require maybe some patches, and some may actually need some psychological help, because I think majority of these children do have a lot of anxiety, depression. So they need to be talked to, and if the doctor actually talks to them and realize that there are some underlying issues, they actually need to go for some psychology treatment, or some at least see a psychologist and help them to get over what their anxieties, their depression, the confusion over life, what it is. But that would be the way, the way to go. Identify them, talk to them, understand them, and bring them to these clinics, doctors, psychologists to help.
Yeah, related to that, I've got one question. How come parents cannot recognize, like the boy you said just now, 1 year he has been vaping, the parents could not identify that?
Okay, so I have all adolescents to adult children. And the biggest problem that, and all my colleagues will have, when we sit down in the pantry, we all talk about the same thing. And that majority of adolescent children do not communicate with their parents. The communication is kept to the minimal, and that's always a problem, because so you actually don't know whether or not, sometimes, whether it's an adolescent phase, or actually they are going through. So some of the things that people have said, that you may suspect. Okay, so if you see, for example, your child is always asking you money, okay, you got to suspect that your child may actually be vaping. Or they tend to spend more time in the room, or for example, they don't want to stay at home. They're always saying, I want to go outside and meet my friend. Or if they are increasingly thirsty, or if they are increasingly irritable, or they have mood changes. But adolescents all have irritability and mood, it's also very difficult to separate the two. Or some even say if they have desire for spicy or salty food. But I mean, we all eat spicy and salty food. So you can see that these signs that a child may be vaping is something that it's not easy, because they don't come back with a lot of the smoke. And again, adolescents tend to be on their own rather than to spend with parents. So but you're right. You see, I think that many of us have to be more aware of what is happening outside, or what's happening with our children, and we need to force these situations whereby we force them to communicate with us. And when you force them to communicate with us, then perhaps you may see this. You may suddenly see this. But I don't blame parents, because I'm a parent of my own, and I realize that there are so many problems, and our role is to make the child strong. So really I'm an advocate for teaching the young, because the young are the ones that it will actually stay in their brain. And it is better to teach them from the young rather than start when they are old. There's no point teaching the old. You teach the young. The young are the ones that will carry on.
Yeah.
Okay, is there any slides showing if the parents smoking or vaping the child? Yes. So actually earlier on, I showed a slide that showed that half of the people, half of these adolescents that smoke or vape actually had either a guardian or somebody that is vape or smoke. So again, something that is important is parental role models. And again, this is not only for smoking. This is for life. This, if you want your child to be a polite person, you want your child to have patience, you want your child to be understanding, you got to do it. And then your child will follow you. And hence, similarly, when it comes to vaping and smoking, if your parent is going to vape or smoke, there's a 50%. I mean, that was the correlation. And definitely they say that they are at an increased risk. So yes, if parents smoke or a close a family member smokes, they are more likely to take up all of this. And it's the same with drinking as well, right? So if anyone in the family is smoking or drinking, you're more likely that the child is actually going to follow this trait, and don't blame the genetics. They are just, this is nurture, not nature, right? They are following their parents. So parental role and what you do, we are very important in molding our children. We are the ones that mold our children.
Good evening, Doctor. I'm Kala Devi. Okay, first of all, I would like to congratulate the EWRF for arranging this, and it was a wonderful talk. I just entered about 10 minutes ago, and I got a lot of knowledge. Okay, Doctor, actually, I'm a discipline teacher, so every day I'm facing with this kind of things. Okay, I just wanted to find out, Doctor, how serious it is in secondary schools. Okay, for example, in a month, how many secondary school students come to your clinic for for consultation or for treatment?
Okay, so what is happening now is that majority of these children are not actually being identified. So when you talk about them coming to my clinic, there will be not many. So the truth of the matter is there will be not many. So what will end up at the end of the day is that they're actually going to be vaping quietly, and that later on in life that they may give you a problem. Of course, I also see pediatric patients, and the problem is that many of them are going to run into their problem when they are 20, 21, 22. So they may end up in the adult ward. So I may not really have the proper information about the adult ward lah. Yeah. So that means that means that although you don't see it as a big medical problem, okay, we know that this is going to have a spillover effect in the next 10 or 20 years, and you can hold my word to it. You can hold my word to it, because you just have to wait and see that all these adolescent is going to run. And you must remember that, don't forget that there is a problem with the brain, that these these chemicals actually will cause a problem with the brain. And as I showed in one of those pictures, there's like the bi-directional effect. We already have a problem with anxiety, depression, etc. So these chemicals actually can make the situation worse. So it's not only about the lung. Don't forget about the brain and the behavior problems as well. But you will not see such an acute effect. It's just like smoking. Like smoking, when an adult smokes or when a child smokes, you don't really see the effect now. You are going to see the effect in the next 10, 20 years, maybe 30 years, when they enter into the working force. And these are the people that cannot work. They may have already families, and then we will suffer.
Doctor, I just wanted to find out, are there any ministry giving any talks to any schools? Are there any programs like that?
So far as I know, not really. Not really. But I did my own survey. Okay, so I actually did my own survey in my little asthma clinic. And what I did find is that I found many children that were less than 10 years old, and they knew about vaping. And when we've asked them how they knew about vaping, they were saying that their schools were already teaching them. So I was extremely pleased. So that was 80% of children who were less than 10 years old already knew about the vaping, and it was because the teachers were already teaching. So if you look at my slides, there's not much information in it, because I think that we keep it simple and keep it to what people want to hear. Like I put on the pimples and all that, because that's what they are actually worried about. And so that perhaps I would want to say that the medical people may not are not ready, or are actually not doing it yet, but I would really like the teachers or to empower the teachers to start doing this. And I think it's quite easy again to influence the young. The 7, the 8, the 9 are actually easier to influence. And so we just have to teach them that this is not right. But unfortunately, in terms of ministry, not really, no. You'll have to reach out to individual hospitals for that.
Okay, doctor. Thank you so much. Okay, doctor. Just one more question. Like I caught a few cases where the students always bring the vape, and the parents don't know about it because they don't do it at home. They do it mostly in the school itself, because these kind of students always wanted to go out every 15 minutes, 10 minutes. So we managed to find out. Okay, there are cases of students, doctor, where they order online
Yeah.
the chemicals, and these got very, very, very high. So causing a lot of problems. So how about the online chemicals? Are they very famous among Malaysian students? Please advise.
So I just also showed in one of my slides that 30% of when you look at vapors and you ask them where do they get their what do you call it, where do they get their information. Sorry, that means that when you look at advertisements for vaping, in social media, 50% is actually from the vaping companies directly. So again, that means that our legislation is not strict enough to stop these advertisements in social media. So what we need to do is actually do exactly what we did with cigarettes. We need to put that stamp of the boy, that is sick in hospital, the man that is sick in hospital, take out all the colors from all of these vaping products, and stop selling them as a social, what they will call it, a style. We need to reduce the advertisements, and we need more legislation on this. So we need more tax, we need more legislation, which really needs to come, and we haven't reached there yet. And I know if you listen to BFM, there's a lot of talks recently going on, stressing on the government that they really need to do more. Having this, ban on selling all of these things to teenagers, we need to see enforcement. And really, if you go to Singapore, do you know that Singapore literally is just illegal it's just illegal. Just the Singaporean way is just make it illegal. And it's just illegal to vape. And that's how they control. And in Singapore, it's so easy to, make you pay 2,000, 5,000. But in Malaysia, enforcement is a huge problem. So we need to improve, in every aspect lah. We need to improve on this enforcement, but we don't have a regulation to stop this advertisement. We need this regulation. Is not here. And like I said, there are many people already talking about this on BFM and on the news. So the government knows that this is a problem. It's just whether or not they are willing, whether they are willing to do it. So somebody mentioned that it's illegal in Johor too. Illegal to, you mean to sell, right? So it's supposed to be illegal in Malaysia now to sell totally and even to vape as well. Okay, so the latest vaping law in 1st of October is you're not allowed to vape in 28 types of places, which of course it involves eateries, involves universities, etc. But again, you will have one or two of these people that is going to be doing it, and I want to see who is going to enforce this regulation. And everybody says it will always take a longer time in Malaysia. But I hope it won't take too long, hopefully.
Okay, the last question, yeah. Okay, which ministry will have all these kind of statistics, and which ministry is responsible to curb this problem actually?
It's under Ministry of Health.
Okay,
So
thank you.
so if you look under Ministry of Health, and the statistics is under maybe under Ministry of, or the Ministry of it should be under Ministry of Health. But the national morbidity data has already published data in 2022 about all of this. So if you go and Google national morbidity data 2022 and you put adolescent, they have a huge document that looked at all of this in nearly, I think, 50,000 adolescent or children on all the different problems with adolescent, not only with vaping and smoking. So you look under national morbidity data, the Malaysian national morbidity data 2022, and put adolescent. They had a special book, which is where I actually got my information when I was talking. Okay, so I think I'm going to end. Yeah, no problem. I learned very much about this topic, preparing for it, and of course, again, as a lung doctor, I don't like to see anybody smoking. I'm allergic to smoking, and etc. So let's hope that the government enforces all of this, and that that there's a lot more action, less talk and more action for us Malaysians. Okay, with that, I'm going to say bye-bye. Thank you
Okay,
so much.
Thank you, Prof.
Thank you.
Prof, okay. On behalf of EWRF Malaysia, thank you so much, Professor Anna, for the very informative session. We truly appreciate your time taken for doing all the research and spending your Thursday evening with us today, despite your busy schedule. So I'm very sure we all learned something valuable today. And it is very clear that more people and also youth should actually attend such talk. And if you'd like to rewatch this recording, this is available on our YouTube and Facebook channel, EWRF Malaysia. You also can find all our past professional talks there. And we look forward to seeing all of you next month with another exciting topic. For more details, you can always log in into our website, www.ewrf.org.my, Facebook, join our WhatsApp, or maybe you can join our Telegram group as well. So with that, thank you again, Professor, and have a great evening, everyone.
Okay, bye-bye, everyone. Have a good evening.